In the US, something as routine as treating a broken arm can lead to a staggering medical bill, often over $10,000. In Germany, the same care might come with a minor copay, or nothing at all. The contrast is jarring. Same injury, same treatment, vastly different price tags. The US spends more on healthcare than any other country, over $12,000 per person per year. Yet this high spending doesn't translate into better outcomes. Americans have lower life expectancy, higher infant mortality, and millions still lack reliable insurance. Meanwhile, Germany, a country that covers everything and spends far less doing it. The difference lies in how each country approaches healthcare. In the US, healthcare is a business. Insurance companies, hospitals, and pharmaceutical firms operate on a profit motive. There's no unified system, just a patchwork of private and public plans, each with their own rules, rates, and billing codes. The result is a fragmented, confusing, and extremely costly system. Germany treats healthcare as a public good. Insurance is mandatory, and citizens can choose between public and private plans, both of which are tightly regulated. Prices for services and prescriptions are negotiated and published, ensuring transparency. Everyone is included: children, retirees, unemployed citizens, all receive comprehensive care regardless of income. One of the biggest cost drivers in the US is administrative overhead. Complex billing processes and thousands of insurance codes create inefficiency and waste. In Germany, standardized processes and fewer insurers make the system faster and cheaper to operate. Drug prices also reveal a stark contrast. In the US, pharmaceutical companies can charge virtually whatever they want. In Germany, prices are negotiated by the government based on a drug's actual benefit, keeping medications affordable. Germany's system is designed to prioritize people. The US model, despite its advancements, often prioritizes profits. The American healthcare system is notorious for being expensive, and that's no accident. It's a tangled web of private insurers, government programs, and billing complexity that drives costs sky high, without necessarily delivering better outcomes. Then there's the issue of drug pricing. In the US, pharmaceutical companies can set virtually any price they want. There's little regulation. Americans routinely pay 3 to 4 times more for medications than people in other countries. In Germany, prices are negotiated based on effectiveness, which keeps costs under control. Hospital pricing is another black hole. A simple procedure like an MRI could cost $400 in one facility and $4,000 in another, with no quality difference. Pricing is negotiated in secret and varies wildly. Germany, by contrast, has transparent, standardized rates. There are no surprise bills. The US also leans heavily into high-tech care, often overusing expensive equipment and tests. It's partly due to defensive medicine and partly because the system rewards quantity over quality. In Germany, doctors follow evidence-based guidelines and are paid in a way that discourages overtreatment. Even having insurance doesn't guarantee security in the US. High deductibles, copays, and network restrictions mean many insured people still can't afford care. In Germany, everyone's covered by law, and the out-of-pocket costs are minimal. Germany uses a universal multi-payer model. Every resident is required to have health insurance, either public or private. Around 90% choose public coverage through non-profit sickness funds, while higher earners and the self-employed can opt for private plans. No one is left behind. In the end, the contrast between the US and Germany makes one truth clear. Healthcare is not just about medicine, it is about values. Where Germany has built a system that treats health as a shared responsibility and a public good, the US continues to struggle under the weight of profit-driven policies that leave millions vulnerable. No system is perfect, but Germany proves that universal, affordable, and efficient care is possible when equity and transparency are prioritized. For the US, the challenge lies not in whether it can afford such reform, but whether it is willing to align its system with the principle that every life deserves both care and dignity.